Is your dog being treated for a fungal infection? Fluconazole is a prescription antifungal commonly used to treat several fungal and yeast infections in dogs. Fluconazole, also known as diflucan, belongs to a group called triazole antifungals. It works by stopping fungi from producing ergosterol, an essential part of their cell membrane. It may be used for infections including blastomycosis, histoplasmosis, coccidioidomycosis, cryptococcosis, candidiasis, and certain yeast infections. Fluconazole dosage for dogs generally ranges from 5 to 10 milligrams per kilogram, depending on the type and severity of the infection. It's normally administered once or twice daily. Severe or systemic infections can require higher dosing and longer treatment under veterinary supervision. Dogs with kidney or liver problems may need dosage adjustments and closer monitoring during treatment. Possible side effects include decreased appetite, vomiting, diarrhea, nausea, lethargy, and weakness. Serious liver problems are uncommon but possible. Fluconazole can interact with other medications, including certain antifungals, pain medicines, neurological drugs, heart medications, and blood thinners. Treatment may last several weeks or longer depending on the infection. Give every dose exactly as prescribed, and don't stop treatment early. Fluconazole is a prescription medication. Always follow your veterinarian's dosing instructions and contact them if your dog develops unusual or severe symptoms.
For a dosage calculator, detailed benefits, potential side effects, which dogs should avoid this medicine, and safe serving ideas, visit our website through the link in the description.